guys all for coming, taking time out of your busy schedules. Everybody that doesn't know me, my name's Jennifer. I'm the manager here at our Boca office. These are amazing estheticians, Caroline and Jess. This is Jane, our cosmetic coordinator. Our beautiful nurse practitioner, Kimberly Bisogno. Last but not least is our Dr. Shashidhar Kusuma.
You didn't use the word beautiful.
Our handsome Dr. Shashidhar Kusuma. He's going to be speaking today about the art facial. It's one of our newest procedures. We have definitely refined it over the last couple months, and I can't wait for him to teach you all about it. Okay?
I know some of you, welcome back. Nice to meet you all for those of you who haven't met. I wanted to share with you some recent advancements in skincare specifically, and what we in our practice are doing that we believe is very different and very comprehensive and very thorough as compared to what's out there today. Okay? So I'm going to show you some pictures, but mostly I'm going to try to explain the concept because I think it's important. So I'm sure many of you here know, right, what microneedling is. I'm sure many of you know. I'm sure many of you have done it. And when you do this, you probably just do that one thing and say that it works or not, doesn't work, whatever the feeling is it is, right? That's one service. I'm sure many of you know laser treatments for skin. Many of you may have also done it as well. It works, certainly works, and it does what it does. So, but that's usually just one thing. I'm sure many of you have heard of PRP treatments as well, because it's now become a common, word, as in Kleenex, because people do it for pain, people do it for bone injuries, people do it for faces, all kinds of stuff. But there's an art and science to it as well. I'm sure many of you have heard of dermaplaning. So there's a lot of skin services that are offered, but it's very much limited in scope because it's just one thing that you do. It's almost like going to a 5-star restaurant and only having an appetizer and leaving. You never get the full breadth of experience, and there's many reasons why some things are done and some things are not done. First and foremost is fear of adverse outcomes, because if you do too much, you may have safety issues, right? You could burn somebody, or you could create an injury in somebody, or whatever the case might be. So there's a fear of that. So many doctors, many providers are not comfortable doing many things at one time, especially dermatologists, because they're very, very delicate with what they do. As a surgeon, I'm a bit more, I guess, open to doing a bit more aggressive stuff to get better outcomes. So that's safety is the first thing. The second thing is about effectiveness, because everybody wants results, right? Everybody's focused on results, and so are we. In a practice like ours that is focused on aesthetics and skincare and fillers and facelifts and all these sorts of things, we are very focused on outcomes as well. And we can only do what technology allows you to do today, right? That's the extent of it. So if you have a car that only goes 60 miles an hour, that's all you can do. You can't do any more than that. Similarly, when you're taking care of patients, you can only do what you can do, right? And so one of the concepts we came up with is that, well, how can we take the best breed of devices available and combine that with the knowledge of skin and aesthetics of the face or skin in general, and how do we deliver that to patients safely and effectively? So the first question everybody would probably ask is that, how does it work? How long does it last? And is it really going to give me a difference as compared to a laser or compared to microneedling or something? That's a very common thing that people ask. And so I want to be proactive about that and pretty much explain to you guys that we could do individual treatments, as I told you, on their own, standalone treatments, like a CO2 laser. It's a tried and true method of skin resurfacing. We've done it for years. It works, and it does what it does. Right? Microneedling does what it does, and it works, but that's all it does. So can you imagine, however, combining all of it together in one setting? So in one session, essentially, you come in and do all of it in combination. And you can also say, why should you do that? Because if you think about skin is a multi-dimensional anatomical structure, right? It's not just the top of the skin. Skin is actually very, very complex organ, essentially, on the body. And so if you start treating on the top and stop there, that's all you do. So for example, if you do a CO2 laser, it starts by working from the top, that's it. It doesn't go any deeper than a few what we call microns depth. That's all it does. It is effective, it most certainly works, but that's all it does, right? But deeper to that level, there's a lot of other things as well, right? And so how do you treat that? Are you going to treat that or not? And if you don't, why don't you treat that? So now if you kind of have another device that can go beyond that, few microns depth and go to the deeper area, then you have another avenue to treat it at the same time. And then you say, well, I've treated something effectively, I want to augment the healing process, and so I want to drop ship some very good products there, to heal after you treat it. So many times, in the aesthetic world, we put some creams on, we put some potions on and stuff to help with the healing process. But now, what people are experimenting with and learning and doing is using your own body stuff to help the healing process, right? So if you have an injury, you go through a healing process that your body does on its own. You don't really do much of anything, it just heals, because there's cells that come there, there's growth factors that come there, there's all kinds of stuff that happens to make that injury better. Similarly, we in this process are actually creating an injury, right, from the top to the bottom, with the laser on the top, with the needles in the deeper aspects of it, and all these sorts of things we're doing. And at the same time, we're thinking, well, it'd be great, wouldn't it be wonderful if you can actually put all the necessary ingredients for the skin to heal as best as possible. So you can either apply it on the surface, like a cream does, or you can actually inject it into the skin, exactly where you created the injury, so that the areas have what they need to heal well, right? Heal quickly. So now, if I were to already put this together, you are comprehensively treating skin from top to bottom. You're doing all the latest and greatest available devices and techniques in one setting. You're doing it very, very safely. And now you're drop shipping all of these great products from your own body that make it heal better. So you're increasing the healing time, or making faster the healing time, and allowing people to get back to work in 2-3 days at the most, very, very consistently and reliably. So that's the general concept. So what is an art facial? The reason that we are all here today. Art facial, we call it advanced regenerative therapy, or in the scientific community is also called autologous regenerative therapy. Advanced regenerative therapy because we are advancing the treatment choices and doing it all at one time, and really advancing the science and treatments of skincare. Regenerative essentially means to stimulate your body to regrow and repopulate with healthy cells, healthy tissues, etc. And therapy is basically the treatment. That's the art of the art facial. And facial is because we're treating the face, but you could treat any part of the body really if you so choose to do, like the hands, the chest, any part of the body that you feel needs improvement. So this is not a miracle, right? We're not promising the world, we're not promising miracles, but we're basically saying that we could offer the best in breed, at least in our opinion, in our experience, skincare services available. And this is a treatment that typically takes about 2.5 hours to do. It's a long process because it's a very involved process. There's about 5 different steps that are done all at the same time. So we have to prep the patient properly, we have to do a bunch of different things, and so it takes 2.5 hours. Almost all of it is done in everybody to date under what topical anesthesia. Topical anesthesia essentially is putting creams on the skin. And I'm going to show you a picture of somebody that I typically use. This is the case, literally, that has made me rethink the way I was approaching skincare, and I want you guys to see this picture.
I have your computer here.
I'm going to post this directly on there. And this is, this may not be typical for everybody. I'm not promising this for everybody, but I do think people need to see this because this is the case that really changed the way I've approached skincare. And ever since then, I've been very gung-ho, and we as a team have been gung-ho on this. So if you look at this in 1 second.
Whoever has any questions, I will give a raffle to. You get a better chance.
Is it more than one process? Yeah, you have to do it several times?
Yeah.
Okay.
We do it. So if you look at this person.
Wow.
So I'm just gonna stop talking for about 15 seconds, 20 seconds. I really want you guys to just see that face. I want you to really focus on all the various parts of the face, okay? The lips, the skin quality, the cheeks, everything. Yes,
Is that your patient?
of course, these are all our patients.
That is not that same person.
It is too.
That's amazing.
So this is, you know, it's amazing to me on my side of the table how often I hear that same response. Every single time to date I've shown this picture, that's the exact response I get from almost everybody. And I am not at all saying, I'm a very transparent person, or I try to be. I'm not saying this is going to be the case with everybody that you take care of, because there's always a variation. Like if you give medication to people, some people respond really well and some don't. It's just the way of human beings. But this is the case that really, really changed and transformed the way we all started thinking about skincare. Okay? Yes?
How did you know to how old is that woman?
She's 71.
Did she have any other procedures done?
Yes, she did. She did, and I'll tell you exactly what those are. But the focus of today was skincare, and that's what I want you guys to focus on, but I'll tell you exactly what she had now.
Can I take a picture of that?
Of course.
Is that count as a raffle ticket?
Yeah, exactly.
So you take it for passing.
But you gotta give us credit though if you use that picture.
Absolutely. No, I want to show my sister-in-law, my mother-in-law.
So
Thank
take a look at her mouth area right here. She has a little bit of makeup, obviously. You know, she has some lipstick on. She doesn't have it here. But even then, if you have very crinkly, you know, skin, you're gonna have makeup stuck there. It's gonna look actually worse, right? So this is not touched up by filters on the phone. This is you know, this is her. And look at her cheeks. So what this lady had done are 3 things. The first and foremost is that you could see her neck. It's very, very, very full, and you could see these streaks of skin because she has lost all elasticity of the skin. She has none whatsoever, because like if you full skin, you want it to snap back, right? She has nothing. And her tissues are so delicate that if you put a stitch through it, it actually cheese wires and pulls right out, because there's no substance to it, because she's just that delicate. You know, she's a very dear friend of mine now, and she tells me, Doc, you can do whatever you want to do with me whenever you want, and you can talk about it with everybody, so I'm very open about it. She was a beer drinker. Okay? She was a beer drinker, and the reason that's important is because she didn't smoke. She didn't smoke, but she was a beer drinker. She loved beer. So, and the reason that's important is because you have to, as a doctor, right? You know, I always tell my staff this, and I think about this. Before you're a plastic surgeon, you have to be a good surgeon. Before you're a surgeon, you have to be a good doctor. In order to be a good doctor, you have to be a good listener and a very curious person by nature. You can't just be a technician and do stuff all day long. You have to think about stuff deeply and constantly, right? So why is beer drinking important? Beer drinking is important because she pumped up. She got fat, you know, literally, right? And so the tissues reflect that. So when you start dissecting her, she's got tissue underneath that's that thick. And it's like butter when you dissect it through it, and it has no substance to do much with it. Just kind of, it's like you can put your hand, it just goes right through it.
Doesn't alcohol also dehydrate the skin?
You can, of course. Of course it does, and that's why the skin could be so dry.
Could she have sun damage? It looks like she had sun damage.
She's in South Florida all her life, yes. Yes.
Not just a beer.
Yes, she has all the classic signs of,
I mean, it looks like a lot of sun damage.
yeah, she never did anything for herself. She's been a mom like most of you guys are. We are fathers and busy with life and busy with kids and busy with grandkids, all the stuff. So what really motivated her to do something finally is that she was going to her 50th college reunion at Emory University, my alma mater. So I took it extra special, right? Because I went to college there too. So that's why she started to do something. She said, I need to do something for myself. So after I did this, I did her tummy at 71. I removed a bunch of skin of her tummy. She's now much flatter, looks better. And you know, so you know, it's interesting how her perspective about a lot of things has already changed in just the last 4, 5, 6 months that we've seen her.
What about her eyes and her nose?
So I didn't do anything to her eyes. You can see actually, you know, if you're observant, it's very interesting, right? People don't necessarily want to look in the camera because they're embarrassed or they just don't want to. I mean, it's a subconscious thing, but you see this all the time. And you can see this. I mean, I didn't tell her to do anything different than what she has done in the past, basically, you know. But just the persona, her confidence level, her comfort level is different. So I didn't do anything. I would like to do something because this eyelid is droopy. And this one is not so much. So I'd love to do something about it, but she didn't want it. She was okay with it. She has an oculoplastic surgeon that takes care of her. She said, you know, I'm going to go.
Excuse me, how many art facial did you have?
She had 3.
That's what I was wondering.
She had 3. So now to answer your question, how many do you need? I don't know. I mean, that's the real answer. This is all new territory for all of us, okay? We are applying our knowledge of what we've learned in general surgery, skincare, plastic surgery, aesthetics, and extrapolating to what we think is good in this process. Because remember, we're doing a lot of different things to the skin, right? We're doing what we call dermaplaning to the skin. We're doing radiofrequency treatment to the skin. We're doing CO2 laser to the skin. We're doing microneedling to the skin. We are also infusing the growth factors and the cells into the skin, all of it at one time. That's a lot to do.
Do you have to keep this up with the same art facial every once in a while, or do you use other procedures
Yes.
to?
So again, still evolving, right?
Okay.
So applying our knowledge base of general skincare, we almost always recommend 3 treatments. Anytime somebody comes in for just a simple Vivace treatment, which is also very effective, like we said, this cool peel CO2 is very effective. You know, all of these are effective on their own, but this is like getting the whole enchilada, right? There's no reason really not to do this if you can do it all at one time, because it's the most effective thing.
How long does this last?
So that, I'm gonna get there. So I'm gonna try to put it all together as I'm going along, but thank you for asking. So
At what age should you start doing this?
if it were up to me, I'd put people in a program from their 30s up to the time of their death.
Okay.
It's
Because
also a
aging starts.
lifestyle, okay? So, you know, someone that's fair skin blonde isn't gonna weather as someone that has darker skin. Same as someone that is a boater, a fisher, or a golfer. Their skin, it's your lifestyle also. So that's what we can't tell you. If you get sick, we can't tell you how long it's gonna last. It pushes back the time, it doesn't stop the time.
Yeah. So you know, the length of time it lasts, we really don't know yet, because skin continues to age. It's like diabetes, right? You know, if you get an insulin shot, you got to go back and get some more the next day. It's like exercise. If you work out today, it's the same thing. So there are really, you know, there are no miracle solutions. They're just good solutions that need to be sustained over a long period of time. Really, that's the truth in medicine and plastic surgery. I know there's so much Instagram BS out there, right, that all of you guys read. There's a lot of stuff out there, but you got to really be able to decipher and really understand what's real and what's not real. And that's one of the things that we are working very hard to do, is to kind of be real about all this stuff. So to answer the question, how long does it last? I don't know, nobody knows, but we do know one thing. We are inherently changing the quality of skin. With what we're doing, we know that for sure. It's like when you go to exercise and lift weights or run or something, you're changing the muscle function. If you are stretching and doing yoga, you're increasing your flexibility. You know you're doing that. Very similarly here, when you're doing skincare like this, we 100% know that we're affecting and changing skin quality for sure. And if you maintain it, obviously it's going to last as long as possible. Go ahead.
What's the downtime between?
So I'll show you some pictures of that as well, because we have people that are real people. One of them is actually sitting here. We,
And Lorraine
yeah, there's
Yeah.
two sitting here.
And I'm older than that lady.
Yeah.
So it can last a long time as long as you maintain it, but we are seeing peak results from one treatment around 4, 5, 6 weeks of time on average. Until then, skin feels a little dry, a little bit rough to the touch, and all of that has to heal. And you do have to do some topical treatment and stuff to maintain, but we're seeing maximal results around 5, 6 weeks or so. And then since we recommend 3 sessions, because many times people who've never done anything need that much work, so we go back and do another one 6 weeks later. And then we wait for it to heal, and then we go back and do another one 6 weeks later.
Can you wear makeup during the downtime?
Just the during the healing time for the 2 days or so that I'll show you, you shouldn't, but after that you can. So the other question was how many do you have to do? Like I said, it's like 3 sessions we recommend, but you don't have to do 3, but that's what we recommend. I want to be clear about it. So people always say, well, if I'm taking blood pressure medicine, how much do I take and when do I take? They want specifics, right? But skincare or plastic surgery is not like that. It's a little bit more open-ended. There's no hard fast rules because this is like nobody in the world is doing this, what we're doing right now. We don't know. We're just figuring stuff out.
But what is your face gonna look like after you do the procedure? Like, is it gonna be bruising?
I will show you.
Is there
I
gonna
will
be
show
like
you.
He's gonna show you.
peeling your face off?
Yes,
Is
I'll
it
show
like-
you.
Can you go out of the house the next day? Like, that's what I wanna know.
How long is the other side?
Forever.
Not
No,
if you live in
but-
Florida.
No, but honestly,
Gotta get in your car.
the immediate period right after, for about a couple of weeks, we recommend you not be directly in the sun. But with a hat, when we do faces, people go out. You have to go out. It's not, So for 3-4 days or so, we recommend not to do too much sun exposure at all. After that, if you put sunblock, you can go out in the sun.
But the heat bothers it, right?
Heat can bother it,
Yeah,
yes.
it agitates
Yes,
it.
of course, yeah.
Okay.
Yeah.
When did you start doing this, and how many have you done? And have you ever said to anyone after the second time, no, you don't need a third treatment?
I'll get back to you 1 second. I did not forget, but the number of cases we've done. So we came up with this concept about 4 months ago or so, I think, and since then we've done over 60 already. 65. So I don't know exactly what we have a running count. On a weekly basis, we do 3 or 4 of them on average. So we've been doing quite a few of them, and many times I'm doing it in conjunction with surgery. This Saturday, I have a full face makeover, facelift, eyelids, fat grafting, bone marrow, artificial, all of it together at one time. So we're doing that along with surgery as well. So when people have breast surgery, we're doing it, so we're kind of mixing and matching these things because they're already asleep. So we've done that many so far, okay?
Well, if you've been doing it for 4 months, you probably haven't done too many patients the third treatment, if they're 6 weeks apart.
Math works out that way, you're absolutely right. Yes, we haven't, but we have done a few. We have done a few every 6 weeks, that's about 18 weeks, right? So that's something that we have done, 3 up. This is the first lady. And so we have enough experience to see that result. And so that's the number we've done. And so the second one you said is that have you told people after the second one you don't need anymore? This is not something that's a valid response in my opinion, because it's almost like it's a subjective thing, right? In a sense, what you're asking for is a subjective thing. It's not like, again, I go back to things that are very hard and fast and things that are more open-ended. If you're controlling blood sugar, if you reach 100, then you're good, and then you know a metric of what that is. If you're doing blood pressure, you get to a number, you know exactly where you want to be, but this is very subjective. It really depends on my opinion of how good the skin is and the patient's opinion of how good the skin is. So I have not yet said that because I don't have enough time to evaluate that, because I'm trying to see how far we can push to get, how good an outcome we can get. Because something else we're noticing in these patients as well, which was not there when we first started it, is that we're noticing tightening of the jowl area of the skin. We're noticing some plumpiness of the skin because we're actually infusing their skin with products, right, essentially. So they're seeing some plumping from that, so that also has a benefit. It may not be, pigment correction, it may not be wrinkle correction, but they're seeing plumpness of their face, so they look healthy. They look very bright and healthy and really full, like they just woke up from a great sleep or whatever it is, so that's also has a benefit that may not be exactly, like just skincare alone, right? So that's the second thing. And the third thing you asked was, what was that?
You covered.
I covered it, right, okay.
I'm sorry, what does this cost, and do you have other pictures of other?
Yes, I will show you. So the cost, I've been beat up in my office
He's
not
not
to
allowed to
ever
talk
talk
about
about it.
Did we talk about that?
Not to ever talk about it. So I have promised myself that I no longer am going to speak about cost anymore. I'm going to try to stick with it. That's my 2020 resolution. So I'm going to have the staff let you know about that, but it's very, very valuable, I can tell you that. I measure life in value, and so it's an extremely valuable service, because if you do one service alone, it can cost you X amount of money, but we are doing so much that I think the cost is very, very, we feel it valuable. So this is another person I'll show you, another picture. And I'm trying to do it this way because I want it to be real, okay? I'm not doing a canned talk, I'm really doing it with real people in real time.
I have a question, that person that you did, because you mentioned doing other surgeries, with a facelift, you would do a facelift and this procedure?
I did, in that other lady's case, I did a facelift, meaning the neck area, and the jowl area I did surgery.
This one that was a
On the first one, and I did some injections of the face, and I did the art facial. So I did surgery, I didn't do anything, but I did what we call a lower face and neck surgery.
Would you have a picture of a before and after, just art facial, or?
Yes, I do. I will show you that as well. And this lady is a doctor. She's a very dear friend of mine. She's a physician, internal medicine doctor, and she is just an art facial and some minor little things, and I'll show you her outcome here as well. And I'm doing this back and forth because of HIPAA privacy reasons, obviously. So if you take a look at this lady.
Okay, that looks wonderful.
So just observe her. So she is I think 47, I believe, if I'm not mistaken. She's an internal medicine physician, practices right here in South Florida. So she was not into surgery. She didn't want to have downtime. She's has to see patients, blah blah blah, right? So wanted something effective and stuff like that. So she came to me and said, I don't like these bags. I don't like these cheek lines. I just kind of feel like my skin looks dull. What can I do, right? So in this case, this is her post, obviously. In this case, I did some disport of the forehead, which is very similar to Botox. It's the same thing. So smooth out her forehead and the what we call the glabella area and the corners of the eyes. And then I did some fillers underneath the eyes here, just Restylane, Juvederm, similar stuff like that. I put some of that there, and I did some injections along the cheeks as well. And we did one art facial on her. So I could not, I believe this is a spectacular result for non-surgical changes to a person's face that looks very natural. So one of the things that I've noticed, and everybody's noticed, that this skin just looks healthy. It just looks like it's plump, it's clean, it just looks healthy. I don't know how else to describe it, because I've seen this now in over 60 patients. They just look healthier and cleaner, because I think that's what you're doing. It's not just about kind of looking like with makeup on, but they're just without makeup. There's no makeup there, just very clean and healthy looking.
That's no makeup?
That's no makeup.
She doesn't wear makeup.
Yeah.
She's a very plain Jane.
Yeah, this is no makeup. This is the way she normally is, and she didn't change what she
Hi,
does. You
Jane.
know her. I don't know she. But anyway, so that's another picture of it before and after. After I could not until this protocol get that type of a change with one treatment, just doing injections alone or just doing one thing alone.
Is she coming back for a second?
She may or may not, I don't know, because she's happy now. That's another thing you said right there. So it may not be me, because I'd love to do 2 or 3 more on her personally. But she's happy, so it's up to her if she's going to come back or not. But I do know she's doing other things. But I don't know about the skincare, but I believe she's going to come back, yes.
if she's happy and she looks that good, why would you wanna do another?
Because it's gonna change, right? You know skin's gonna age. It's not,
Wouldn't she come back then?
you can, it's almost like, I guess, how can I explain it the best way? So if you are in therapy for knees or for mental, whatever reason, you should maintain that to be in front of that type of atmosphere all the time. So I think, whether it's exercise, whether it's sleep, whether it's skincare, whether it's whatever, the people that are most successful are people that are consistent. Consistency is the key, because that's why I don't believe in fad diets, that's why I don't believe in, New Year's resolutions, I don't believe in any of that shit. It's just a waste of time. You just need to be consistent and do it day in and day out, regularly, all the time. Maintenance. And so that's the thing, is that, so you're right, she looks great, she's happy, she may come back, she may not, but she's now motivated, because if you notice, she's very sunken in. And the reason she's sunken in is because she started working out like crazy. So she's in this health mode now. So she's very healthy because she lost weight, she's exercising, she's lifting weights, she's got a nice figure, and her face didn't match. So I know mentally she's in a different place than she was a few years ago. And for that same reason, I do believe she's gonna come back and do a lot more.
I saw her yesterday. She's very, very happy. She just looks like a totally different person, more internally, and it's showing through her smile, her confidence, the way she walks. She's a beautiful person naturally. This just took it to a whole nother level. So she's definitely very, very happy inside and out.
And she's not the only one who has had the art facial who's come back saying, I can go without makeup. There were like 2 others that had come back saying, I'm not wearing any makeup, I wanted to go on my trip without wearing anything. One was going on a cruise, and she said that afterwards she was able to just go without any makeup and feel good. So that was nice to see.
So I'm going to show you another one. This is a disclaimer here. I'm going to just go down. This is the post picture is something that the patient sent me, and I did not take it. And I did ask her if she did anything to the photo, and she swears she did not, so that's a disclaimer. So this photo we took, this photo she sent me from work. So I'm putting a disclaimer out there that, because I asked her, because she texted it to me from New York, so I don't know what she did, but I specifically asked her, did you do anything to the photo, did you filter it? She said, no, I just took it in my office, I was just standing there, you asked me, I just sent it, just like that is not what she sent. So this is an Indian lady with the darker skin pigment, so it works for all skin types, and it's safe. So between here and here is 2 days. So she did it on a Friday, and this picture was sent to me on a Monday. So she's got makeup on, clearly, but she was able to put makeup on Monday because she had to fly from Florida to New York for a meeting in New York on Monday. So that's the exact time in this particular case, so that's 2 days. Friday, morning we did it, so she had all day Friday night, Saturday, Sunday, and she went back on Monday and with makeup on. So that's the general downtime.
Did she have injections too?
She did. She did. She had some fillers done around underneath the eyes and a little bit in the cheeks. And I put a little bit in the lip too, actually. Yes.
Does different pigment skin take differently to the procedure? Like, does darker skin do better or lighter skin do better with it?
Lighter skin in general always does better because it's easy to manage lighter skin because there's not much harm you can do because there's no pigment in the skin, to cause damage. The reason darker skin is hard to do is because if you get white patches, it's hard to correct, it's impossible to correct. So you have to be very, very careful.
In that picture, she had dark circles under her eyes. What exactly did you do for that?
I did injections of Restylane under the eyes and the cheeks and the art facial, that's it.
And the hyperpigmentation?
Well, it's improved. It's not fully corrected, it's improved, but with a little makeup, she's much better than she was before, right? So it's a combination of things. That's why the skincare is helping, the fillers are helping, the Botox and Dysport is helping, a little bit of makeup is helping. It's a combination of everything. In this case, it's one treatment so far. Yes. And I'll show you another one. So to answer your question, that's about 2-3 days is the average time that it has been taking people to kind of put makeup on.
Gets rid of brown spots. Gets rid of brown spots.
Well, it evens out the skin tone, for sure.
And So this is another patient that I'm going to show you here.
I just want to say something. Each patient has a different treatment plan. The degree or the depth or how aggressive or not aggressive we do is individual. So it's not like a cookie cutter for every single person. So all the settings are changed. If they have different concerns or wants or needs, most women want around their mouth, so we're more aggressive around the mouth. Or if it's around their eyes, again, but around the eyes it's a lot thinner skin and much more delicate. So we can't treat it as aggressive as we can around the mouth. So it's not like, okay, I'm gonna do the same thing for you, the same thing for you. Everybody is different.
So you're saying 2 to 3 treatments, so what happens after the third? Like how long does this?
So yeah, I'll clarify that even more because that seems to be a lot of concerns about it. But this is another person, that had concerns on the mouth, and this is her after some treatment. So you could see some pores, some stuff here, but generally I even blew it up, as you can see, as big as you can. And so the skin generally has a smoother texture to it. And this is a lady that I've done, lasers on out the wazoo for 3, 4, 5 years, but didn't gain much progress to her liking. And so this again has given me another option to be more aggressive and do more sophisticated things with her. So this is also
So
art
this is
facial.
just artificial?
This is just art facial. No, at this point of time between there and there's been no fillers put in.
Do you have to wait closer to the time, like if you get Botox and fillers, should you wait closer to when you need a retouch, or do you have to wait like a certain, like if I got Botox today, can I go tomorrow and get the facial? Or do I have to?
Typically it's best to do the skin treatment and you can do the Botox at the same time, or you do the skin treatment first and then do the Botox 2-3 days later. I would not generally recommend doing Botox and the next day doing it's not a good idea. Because there's a lot of stuff being injected and we don't want migration of the product in different places, especially kind of Botox and Dysport, because it could cause adverse changes. But a lot of times, this is another thing that I am doing a lot of, or wanting to do more of, and trying to educate and kind of trying to get interest in patients to do, is that I think it would be wonderful for patients really to do 30s, 40s, 50s, whatever age group, do what we call micro aliquots of fat grafting instead of fillers. So every time somebody comes, to make it that simple, that you get about 5-10 cc's of fat, process it, enrich it with the same biological products, and keep adding it once a year or something like that to maintain natural volume in the face versus fillers. That would be amazing to do. Not like a big session of fillers, but a big session of fat grafting, but on a consistent, I use that word all the time with my staff. Consistency is the key. Consistently do it and maintain it over time. So starting in their 30s to 40s, because that's when you start losing, volume and seeing age-related changes. You add small aliquots of fat grafting in different places that predictably age, and start doing skin treatments at the same time. And you may not need to do 3 of them in a 30-year-old. You may just do 1 a year. So it depends on the age of the person and whatnot. But if people in their 70s come, I always recommend 3 for them. But in other patients, you can maybe do 1 a year and 1 session of fat grafting a year. That would be great to do. And then every quarter, you come and do some Botox or Dysport and stuff or other things, because there's no substitution for that so far. So that would be wonderful. So now you're comprehensively treating skin, you're comprehensively addressing volume, and you're maintaining that over time. And then, if you do small little things for skin tightening called thermitight or this, that, or the other, you could even maintain the jowl look for a longer period of time and look great all through your life. And when you're 60, 70, 80, whatever the case might be, you can, if you do need surgery, then you do it at that time, but you're going to look fantastic naturally from a very young age, instead of kind of shotgun treating and this and that, and not really thinking through problems holistically. Because if you go to a doctor, well, I just want a little voluma here, what does that even mean? I don't even understand. What did you actually accomplish? It seems silly to me to do things like that, but if you do and think through the problem and say, how do I maintain myself the best this year, you can kind of have a great program for the whole year. So that's another example.
So we have 2 people that have done art facials here. I don't know if they want to talk and say how their experience was.
I had one, I'm 74, and I think my skin looks darn good. And I will have another one. I'm going away shortly, and once I get back, it's the beginning of March, I will have another one at that time. I think this texture, and you're talking about not wearing makeup. There are many times I'm able to go out, maybe I'm taking the dog for a walk or something, and before I was so self-conscious that I always had a little bit on, but now it doesn't matter. I just go out and my skin looks good without makeup.
So this is about the post look. So this is her on the table as we're doing it. This is what she looked like right after we were done. So this is how people generally look, a little bit rough, a little bit red, a little spotchy, blood here or there. You can almost see those little dots everywhere. And that usually about 2-3 days later. I mean, again, another thing that people should understand is that if you're starting in a bad place, meaning your skin is bad like the first person to start with, your response is going to be much worse. So you're going to get more swelling, you're going to get more reaction, you're going to get more downtime per se. But if you're starting in a reasonably good place, your skin is healthier already, you're going to have a less reaction to the treatment. So that also has an effect on how quickly people recover. But universally speaking, in almost all cases, in 3 days, 4 days max, people are able to put makeup and go.
Does it help with like oily skin?
I don't know enough about these specific conditions, really, honestly, because
Oily skin.
we will.
Like if you work and you can't take 4 days off.
Well, people do it on a Friday and they go back on Monday. That's what most people do. I mean, if you're working.
And works on the neck too?
Yeah, this is something we've done on the face, on the neck, and all the way to the chest, and also on the hands as well.
The hands too?
Yeah, but because you would be limited, okay, just so you understand, the products that we're harvesting from your blood and in some cases your bone marrow, there's a limited amount we can get. And so you need more quantity of product to infuse everywhere, then you need more of it. Because one aliquot only lasts so far, so long, or so much area. So if people do more, we just need to do more extraction and more processing and more infusion. But it can be done.
Because I'm a esthetician, I work and I'm lower legs of people, what about the neck. They
Yeah.
do a lot
Chest
in the
and
neck
neck,
and
yeah,
the neck.
yeah. And hands
They
too.
don't know what to do.
Yeah.
Yeah.
Hands too.
Okay.
Just a general question.
Yeah.
The somethingness that you get under your eyes from losing weight, that's from loss of fat under the eyes?
Yeah, lots of mostly, yeah.
So if you regain the weight, does that fat come back, or does it never come back?
So I guess we can be a little bit wonky and be a little scientific about it, so I don't know any other way to explain it. So typically, in you, let's just say, you have a set number of fat cells in your body. So if you have, small to medium amount of weight gain, you're only going to increase the size of that individual fat cell. Like it just gets fat. Collectively, you get fat as a body, but the cells itself is getting a little bit fat. And if you lose weight, they shrink a little bit. So you're not like dividing the cells and increasing the population of fat cells or vice versa. So you're decreasing the volume that you already have. So if you gain weight, yes, it's possible you'll get, because that's why people who are generally fuller or obese look younger, because they just have more plumpness, right? And that's the lady, the doctor I showed you, she looks sunken in because she lost a lot of weight. So you don't necessarily gain it, you just kind of make those fat cells that are kind of shrunken in be a little bit fuller again. But you're not increasing more fat there. Does that make sense?
Yes.
And then you also, as you age, are losing, like the different layers of tissues underneath the skin that keep things where they need to be. They get softer and looser and wider, and then everything behind it starts pushing out. And that also creates that look of bulging and this, that, or the other in different places. So that's very prominent in the eyes. Like if you look at somebody's eyes, you'll notice that they have dark circle underneath, they have a bulge above it, they have darkness, but that's because the tissues that are holding, stuff inside the eye in place, are pushed out because everything holding it is also getting thin and soft and weak with aging. That's just what happens. So You know, that's, I don't want, I mean, you know, that's probably a good overview of the art facial per se. And just to reiterate it, its art is advanced regenerative therapy, also called autologous regenerative therapy. Advanced because we're advancing the science of skincare to a whole nother level. So in my mind, you know, one of the questions is that do you have to keep doing this every single, no you don't. You can do Vivace interim, which is just a standalone Vivace, which is wonderful to do just on its own, if you're not ready for the big enchilada. But even between the art facials, that's a great thing to do, just to do a Vivace. It's a very quick and easy thing to do. It's very effective. You could do that. You could also do a CO2 laser peel. That's a part of the art facial as a standalone as well in the interim period to maintain it. So you don't have to do this all the time and the only thing all the time. But this is going to set the bar that you do, and then everything else is going to be like a supportive treatment for the bar that's been set this high. Because if you really think about it, there's nothing else in the market that does this much at one setting in this comprehensive way that's safe, that's effective, that's good for all skin types, that's economical, and that has only 2 to 3 days downtime, that you can put makeup and go back to work in, and all done under local anesthesia with topical medication. Nothing else out there in the market.
Are you the only one doing this?
We're the only ones that created it, so yes.
So you knock us out for it.
What's that?
You knock us out for it.
No, you can if you'd like. We can give you some wine, you know, whatever. But the goal, I hope, you know, if you get one thing out of this, I hope you get the fact that consistency, comprehensive treatments that last a long time are where it needs to go. Instead of looking at things as a la carte menu items and say, well, Luma cost me $800 or this or that, you should really go to your provider and say, what can you do to help me and give me something that you could do for me over a course of time. Not like go and say, well, I saw this on Instagram, I wanted a Voluma here. That doesn't really do much for anybody, honestly. You should really try to find a provider or a group that really understands and they're dedicating their life to this. And you ask them and you kind of, you know, can create some kind of a program and then you kind of stick with it over time, which is I think what's going to work the best. So here, art facial is comprehensive skincare. Volume can be done with fillers and or fat grafting. And those together can maintain people well, like we said, for a very long time.
Any other questions?
Well, if you're the only one doing this, have you patented it?
Because
you need to do that.
We are actually we're actually working on putting together, you know, different kits because it takes 5 different devices and a lot of different little small gizmos to do all of this together. And yes, so we have copyrighted and branded it. We are putting together a proprietary kit, and we're going to do it you know, properly, because we aim to replace, you know, most other types of skincare because it becomes obsolete.
Good for you. Congratulations.
Thank you.
And how many years you've been working on this?
Like in plastic surgery, you mean?
No, in this.
On the art facial.
Well, I mean, we've been doing skincare for a long time, right? I mean, I was fortunate, you know, I had good training. I trained at Vanderbilt and also went to Cleveland Clinic to do my training, and so we had a lot of access and a lot of opportunities to do a lot of good investigations, and so we used to burn pig skin all day long and try to figure stuff out. So I've been doing it for a long time. But, you know, in practice, we've been doing it for about 13 years, but it's always been limiting and never felt satisfying. You know, it's like, I have a laser, I did a laser, I did this, but it never felt like I was doing, like I got a whole meal that I was satisfied with. So, don't expect miracles, but this is the closest to miracles that we have today. Well, thank you all for coming. Have some wine and cheese and food and.
Yes, there's lots of appetizers. Thank you, Dr.
Thank you.
Everybody got a goodie bag, correct? Gift bag? Okay, in that.